eating?
Spot cut his paw.
Can cats catch a cold?
I didn't know that.
Hey, Dr. Mike.
In today's Ask Dr. Mike segment, what to do if your puppy has a tapeworm or your older dog has heartworm or you're worried your cat is diabetic. Just a few of the many questions that Dr. Mike Hutchinson's been asked recently, and he's here with some of the answers. Good to see you.
Good to see you. Good morning.
Yeah, let's go through some of these questions. So Kelly says, my friend adopted a Weimaraner and the dog tested heartworm positive. She wants to know what the dog's prognosis is and what's involved in heartworm treatment.
So the first thing, heartworm is a worm that actually is in the blood. So this isn't like a parasite that we find in the stool when you go and have a fecal check at the vets and they tell you it's negative. That doesn't mean heartworms. Heartworm's transmitted by the mosquito. So we test their blood. It's a 10-minute test and we can tell if they have it or not. Of course, when they have it, heartworms reside in large vessels and in the heart, so they can be very dangerous and they can kill a dog if they're left untreated. And they can get as big as 8 to 12 inches long. So that's pretty gross if you think about it. You know, if you think about those worms in your vessels. So we need to treat it, but we have to look at an individual and see how many it has. You know, we try to quantify it. So we take x-rays, we look at the dog, is it coughing yet? Is it mild? In the mild cases that are just starting to cough, very good prognosis. We're going to slowly kill off those worms. There's a series of things that we do, and it takes up to about 4 months to 6 months to complete it because we don't want to kill those heartworms real quick. Because if you kill them too quickly, the body will throw embolisms. And, you know, they get excited, the blood pumps. So keeping the dog calm, sometimes we even crate them through that time. We do tricks at home to keep them from being bored, and we slowly kill them off. There's a number of steps in that, but it's changed over the years since I've been a veterinarian, and it's getting better, and it's getting a little bit safer. So we understand it really well, and they can be treated and go back to normal.
Good.
And that's why we want people to use preventives every month, because you don't want your dog to get a heartworm infection, and they're transmitted by the mosquito. So giving them a monthly preventive not only helps take care of intestinal parasites, but also helps with the heartworm prevention.
Good. All right, here's another one. It looks like our 10-month-old puppy has a tapeworm. Should we bring him in to see you? Should we put everyone on the medication for this? All the dogs are on NexGard, so this must be something that's been going on that we luckily discovered. Your guidance is appreciated from Anthony.
Well, Anthony knows that those predominantly are transmitted. Tapeworm is a flat worm that comes in segments, and it's transmitted by ingesting a flea off the dog. So 40% of fleas have the tapeworm, intermediate tapeworm in them. The dog is biting them because they itch, they feel the tapeworm, they swallow, or the cat, and then they end up getting a developing tapeworm inside them. The tapeworm's elusive. It hooks onto the intestine and grows in segments, and it gets bigger and bigger, and you probably have seen pictures of tapeworms that in people can get up to 25 feet long. I know, really gross. And then they start shedding segments. So those segments will come out, they contain eggs, and those segments will come out, and sometimes they'll dry near the tail or the anus, and they'll look like dried up rice, or you'll see flecks on the feces, and sometimes they are smaller or larger segments. But at any rate, the way we treat them is we give them a pill or an injection that will coat the worm so the digestive system recognizes it, and then they just destroy it. It dissolves them basically. So it's very easy treatment, but since they get it from an intermediate host, we want to make sure all the pets are on a flea preventive, so they don't get more. They could get it from a rabbit, eating a rabbit or eating a baby sheep, something crazy. But most of them come from the fleas. And so if we do flea control and we treat the dog, we're okay. Do you have to treat the rest of the dogs? I would say just watch the stools for those segments. I don't think it's necessary to treat every dog. It seems to be individual. The good news is they're not contagious to us. But children, we want them to wash their hands when they're playing with the dogs, because you don't want them to ingest a flea. Flea jumps on them, and then they sit there and they're playing, and they got their hands in their mouth. Next thing you know, they get the tapeworm from the flea that was on the dog.
Interesting. Never thought of that. All right, now here's one about a cat. Our cat was drinking a lot of water, and his vet said since he did not find sugar in his urine that he does not have diabetes. Now he wants to do some more blood tests that cost a lot of money. Do you agree with that assumption that it's not diabetes? Thanks, from Tara and Frank.
Yes, so when a cat truly has diabetes, the blood sugar goes high in the blood, and then when it gets up over 300 is the number. We like it down below 100. When it gets up above 300, it spills through the kidneys into the urine. And so we know that if it's not in the urine, it isn't that high.
Okay.
So it probably doesn't have diabetes, and that's a pretty good assumption. The other blood tests will find out, why is that cat drinking so much? And I think that's an early sign of a lot of diseases that we can help. So I think they're lucky that that cat's showing them that sign.
Right.
Because if you do those blood tests, find out if it's kidney disease or liver disease or bladder disease or some other diseases they can get that will cause them to drink excessively, we can hopefully treat it and help prevent further damage.
Oh, good. Okay. Dr. Mike, my veterinarian thinks my dog's leg should be amputated because it has a bone cancer in it, and I can't bear to see my dog with an amputated limb. I think I should put him to sleep, but I want your opinion.
That's a hard one. Osteosarcoma is a very aggressive bone cancer. It causes a lot of pain, and we do offer amputation and chemotherapy, and in those cases, when you remove the limb, the pain goes away, and they do very well. But their long-term prognosis is not that good today, 6 months to maybe 18 months.
Oh, wow.
So the decision is, do we want to do everything we can? You don't want them to exist in pain. But I always tell people, here's the good part. You and I, if we were to lose a limb, would have a psychological hang-up. We would maybe go through depression and need some counseling. The animals don't get that. When you remove the limb, and I've done this for 30 years, when you remove the limb, as soon as that's healed, they act like they always had 3 limbs. And they don't get that psychological hang-up. So I promise that owner that if they decide to remove that limb, it will give that animal comfort for a period of time. I'm sorry for that diagnosis, so that's difficult.
Yeah, well, thank you so much.
You're welcome.
All right, do we have time for one more? Let's see. No, I think we're out of time.
Okay.
We're going to have to come find you. If you want more information from Dr. Mike, you can contact him at his practice, Animal General in Cranberry Township. Watch for him here as our regular PTL contributor.